Hi, Dave Bykowski here. I'm a registered nurse, and thank you for taking the time out of your busy day to listen to this video. We want you to help us introduce an exciting new test that can help prevent adverse side effects to drugs. That's right. As nurses, we know what a problem this is. In fact, we are constantly educating patients on the new medications they get in hopes to educate them on the possible side effects they may have on a new medication that's been prescribed for them. Well, do you know that 106,000 people die every year because of adverse reactions to drugs? Or that $30 billion is spent every year just to visits to the emergency room? Well, there's a solution now, and it comes in a test, and the science behind it is pharmacogenetics. And right now that this test is being done in the Mayo Clinic to all the patients there, Johns Hopkins, it's being taken care of at the Duke University Hospital and Vanderbilt Hospital. So we know that this is already being done. We also know that it's being mandated as a standard of care. The American Medical Association came out just recently and made that a standard of care. So what does that mean? That means that if doctors have not implemented this on their patients and given the test to their patient, and if one of their patients that they prescribe a new med to has a reaction and that infects them permanently or even causes their death, they're going to be held liable because the AMA has made that a standard of care. So there's no way to get around it. Doctors are going to have to be having that test. Right now, presently, only 1 in 10 know about this test. That means 9 out of 10 doctors do not, and that's where you come in. We're looking for nurses to bring and introduce this test to the doctors. Now, presently, there are labs out there that are presenting this to the doctors, and the whole thing behind it really is a fear that the doctors will be in a libelous situation. Of course, they can manage their patients better, and I'll get into that in a second. But what we want to do right now is introduce it to them and let you know that those doctors, for doing this test, they can be compensated between $400 and $500. And that's a lot, and that can really help out a practice. So what does this test do? Well, they swab the inside of the mouth, and then they send off this DNA test to our lab, which is one of 7 in the world that do this, and then they get a feedback on this, and they get a printout. And when they look at this, they're going to be able to determine if a drug that they're prescribing, if there's a chance that that person's going to have an adverse drug reaction. And that way, they can just prevent it right away and give them the alternative, a drug that will not do it, but will still help the patient. The other thing it does is it actually tells the patient whether or not, or tells the doctor whether or not a drug will even work on the patient. Let me give you an example. Right, I had a heart attack this last April. I'm doing fine, so don't worry. But they put a couple stents in, and I have to be on Plavix. Now, the reason I'm on Plavix is to coat those stents so that blood doesn't adhere to it, and I have another problem. But there are people that are taking Plavix on a regular basis as a blood thinner. Now, what happens is 30% of these patients, it doesn't even work on. So when a doctor prescribes it, it's kind of hit and miss in a sense. But if they were to have run this test on a patient, they would see that that drug doesn't even work on the patient. So that's the importance of this. It also will help in dosaging. So right now we know that if somebody has a strep throat, the doctor writes a prescription, so many milligrams, and that's it. But now they may find out that the patient needs a little more than what they're going to prescribe or a little bit less. And that's probably why we see a lot of times when they culture and they see that the medicine that the culture is sensitive to and put the patient on it, it still doesn't work. So we'll be able to stop this parade of guessing, so to speak. All right, so that's a very, very important thing. So where do you come in and how are you compensated? Well, for every test that's run in that doctor's office, when you introduce the doctor, you're going to make upwards of $150 per test. Every test that's run in there, that's right. And you can imagine that if a doctor is going to get $400 to $500, he's going to be testing their patients, and you're going to be compensated $150 for every test. But look, I can go into that in more detail, but if I got your attention and it looks like something you want to do in your area, we're looking for you. And so basically call the 1-800 number that's associated with this video and fill in the information, your name, your telephone number, your email, and also, very important, the code that comes with the ad. So go back to your ad, look at that code, and enter it in the spot that says ad code. Thank you, and I just want to say I know that as a nurse we're all underpaid, overworked, and underappreciated. And so I want to be able to help my fellow nurses with this, and I think it's a great business plan to get people that already have relationships with the doctors. So go ahead, call me. I look forward to hearing from you. Have a good day and be blessed. This is Dave Bykowski saying goodbye.